Did you know that the leading cause of blindness in people over 50 years is not cataract, not glaucoma, but something called age-related macular degeneration, that is AMD? This is how people with AMD see, that is seeing a black spot or blurry vision at the center of their vision, thus making it difficult for them to recognize people's faces, read a book, or even drive safely. The scary part about this eye disease is that many people don't even know they have it until their vision is severely damaged. So make sure to watch this video till the end, because in less than 10 minutes, I'm going to simply explain to you what exactly this age-related macular degeneration, what are its early warning signs and symptoms that you should never ignore, and most importantly, what are the 5 best ways you can prevent yourself from it or manage it. Hi, I'm Dr. Harun, an optometrist here to help you care for your eyes and protect your vision for life. So if you're new to this channel, feel free to subscribe so that you don't miss out future videos that may help protect your eyes. Let's get into the video. Macular degeneration is an eye disease that affects this small area at the back of your eye called macula, which is basically responsible for giving you sharp and clear central vision. Let me show you the difference. This is the normal macula, and this is how it looks like in patients with age-related macular degeneration. As you can see, looking at if it's damaged, right? That is what you call the degeneration. I mean, that's what affects the clarity of your central vision. That's making it difficult for you to recognize people's faces, read a book, or even drive safely. It basically occurs in 2 forms. We have the dry form of macular degeneration and we have the wet form of macular degeneration. 85% of people have the dry form of macular degeneration, and it usually represents the starting point of the disease, characterized by presence of yellowish deposits on the macula, which affect the clarity of your central vision. We call these yellowish deposits dorsals. Let me give you an analogy to understand it better. It's like when your camera lens is dusty, that will affect the clarity of the photo or video you would like to shoot, right? So the same happens inside your eyes, where we can say the camera inside your eye is this macula and the dust on the camera lens is like this dorsals, and that's what affects the clarity of your central vision. And as a result of that, anything that appeared at the center of your vision will become difficult for you to see it clearly. It will rather appear blurry, empty, or even black, which keeps increasing gradually over time. On the other hand, in the wet type of macular degeneration, abnormal blood vessels go under the macula, which may leak fluids or blood flowing over the macula, and that will affect the clarity of your central vision. Although this is less common, but when it happens is usually the severe form of macular degeneration, leading to rapid loss of vision in about 90% of cases. But thankfully, it's treatable and you can prevent yourself from it. So what are the warning signs and symptoms that may indicate that you may have age-related macular degeneration? The tricky thing about age-related macular degeneration is that it often develops slowly and without pain. But thankfully, it gives some early warning signs that can tell you something is wrong with your eyes. The first thing you might notice is when you look at straight lines, you might notice that they start to appear wavy or bent, and that is what we call metamorphopsia. You might also notice that the color of objects appear less vibrant than they used to be. As the disease progresses, you might start to notice a blurry at the center of your vision, or seeing an empty at the center of your vision, or seeing black spot at the center of your vision. And as a result of that, reading becomes difficult for you, making you require more light while reading or need a larger text. And if you don't read, you might also have trouble recognizing people's faces, driving softly, or doing any detailed task that requires central vision. If you experience any of these symptoms and you are unsure of whether or not you have this AMD, here is a simple test that you can do, not only in clinic, but you can also do it at home. We call it Amsler grid test. As you can see, it is just a grid of straight lines with dot at the center. And as I said, you can do it at home because even in clinic, we give it to the patient to do it himself. Here's how you can do it. Hold the card at an arm length, cover one of your eyes, and with your eyes open, focus on the central dot. And without moving your eye, notice if any line appear bent, distorted or wavy. If you notice that, that is an indication that you may have AMD. And if you didn't notice any change, then there is a high likelihood that your eyes are perfectly fine. So what causes this age-related macular degeneration? Well, there are different causes of age-related macular degeneration, but it's most commonly due to aging. And that's why it is called age-related macular degeneration, meaning it is related to age. It usually starts from 50 years, and your risk of developing it double after every 10 years. That is to say, the possibility of a 60-year-old patient to have AMD is higher than that of a 50-year-old, and that of 70-year-old is higher than that of 60, and so on. And it was found that by the age of 75 years, over 30% of people show some signs of this age-related macular degeneration. But age isn't the only cause. Genetic factors can also play a huge role. That is to say, if your parents or someone closely related to you, like your siblings, have AMD, your possibility of developing AMD is higher. Impact is about 3 to 6 times than that who has no family history of AMD. Your race or ethnicity also can affect your risk, because it was found that AMD is most commonly found in Caucasian, that is the white man, people from America and European descent. But that doesn't mean it can't affect you because you are black or any other race. Now, what can you do to prevent yourself from this age-related macular degeneration? The first thing you need to do is to make sure that you eat eye-healthy foods. Several clinical studies have shown that certain foods contain nutrients that can reduce your risk of having age-related macular degeneration by up to 25%. This includes vitamin C containing fruits such as orange and vitamin E containing fruits such as avocado and blackberry. So as well, foods containing beta-carotene such as carrots and sweet potato can also reduce your risk of having age-related macular degeneration. Dark green leafy vegetables such as peanuts and kale were found to contain lutein and zeaxanthin, which are all proven to reduce your risk of having age-related macular degeneration. And don't forget to be eating fish containing omega-3 fatty acids such as salmon, sardine, and mackerel, as they can increase blood flow to your blood vessels and thus reducing your risk of having age-related macular degeneration. Exercise. As you know, the importance of exercise to your body can never be overemphasized. But what we have to know is exercise isn't only healthy to your body, but it's also very, very essential to your eyes, as it increases blood flow to your eyes, it opens up any blockage in your blood vessels like high cholesterol that can cause AMD, and thus reduce your risk of having age-related macular degeneration. If you smoke, it's very important to quit smoking, because smoking reduces blood flow to your eyes, and that's making your macula vulnerable to any damage, and thus increasing your risk of having age-related macular degeneration. And the good news about quitting smoking is that your risk starts decreasing within few weeks of quitting smoking. So yes, try to quit smoking. Protect your eyes from ultraviolet rays from the sun using a quality sunglasses. As you know, it's obviously known that too much exposure to ultraviolet rays from the sun can cause damage to your macula, and thus increasing your risk of having age-related macular degeneration. Finally, make sure to manage your overall health. High blood pressure and diabetes can worsen your condition if you have age-related macular degeneration. So make sure you are keeping these conditions under control through diet, exercise, and medication, or as recommended by your doctor. Finally, what are the best ways to manage age-related macular degeneration? As with many diseases, treatment for age-related macular degeneration is always best at an early stage. Actually, the treatment depends on the type of macular degeneration you have. Although there are more treatment options available for wet AMD than is with dry AMD. In case of patients with wet AMD, a special injection called anti-VEGF injection are usually given to them to stop the abnormal blood vessels under their macula from growing. The good news about this treatment is that the result is remarkable. In many patients, not only that it does stop them from losing vision, but it also regain other vision that they thought it was gone forever. But the key here is cutting it early and regular treatment. So an alternative to this treatment is laser photocoagulation, which involves using a special light called laser to specifically burn those abnormal blood vessels under the macula while preserving the other part of the macula. On the other hand, although there was no definitive treatment for patients with dry AMD, it was found that high dose of supplement of antioxidants can slow its progression. And for people with advanced case of this dry age-related macular degeneration, low vision aids such as simple magnifiers and high electronic devices can help them maximize their remaining vision. If you got value in this video, make sure you subscribe to the channel so that you don't miss out future videos that help protect your eyes. See you next.